So in patients with PCOS who don't have ovulation at all, let's say they have amenorrhea, they don't have a period for more than 6 months, or they ovulate every 2-3 months. So, and they are not ovulating, provided they don't have any other cause of infertility like tubal problem or partner sperm. So then ovulation induction is best treatment. So when we use AMH to estimate first how easy to achieve ovulation induction. Yeah. Second is to reduce to determine the dose of ovulation induction drugs. Third is to reduce the risk of ovarian hyperstimulation syndrome. So AMH used for ovulation induction for 3 purposes: to determine actually who needs ovulation induction. If your AMH is low and if you're having infrequent period, then it's very unlikely you'll have anovulation. Yeah. So because patients with anovulation, which means you're not ovulating, almost always have a high AMH. Why? Because AMH is the one which stops them from ovulating. So if you have a low AMH and if you think that you're not ovulating, you need to review this diagnosis. You need to do progesterone tests, to establish probably you're ovulating. So yes, first is who needs ovulation induction. Second, how likely we can achieve ovulation induction. Third, dose of ovulation drugs. Fourth is to reduce risk of ovarian hyperstimulation in ovulation induction. So essentially, in terms of how likely you can achieve ovulation induction depends on AMH levels. Why? Because if you have extremely high AMH, it's very difficult to achieve ovulation induction. Let us say you have a PCOS and your AMH is like 110 picomoliters. So when you do ultrasound scan for antral follicle count, you have like 80s, 90s small follicles. So AMH is so high, it's difficult to reach that ceiling of AMH to achieve ovulation induction. Yes, you can try. So that's my third point, is to use to determine the dose of ovulation induction. So which means you need to start with a higher dose of Clomid or letrozole. So normally if you start with 1 tablet of letrozole, 2.5 milligrams, in this patient's probably 2.5 milligrams is waste of whole months. You need to start with a higher dose, 5 milligrams of letrozole from the first months. So because for that to reach to that level of AMH, you need very high FSH. The high FSH, the letrozole's job is to induce the production of FSH, natural FSH. So to reach such a high level of FSH, you need to start with a higher dose of letrozole. So, and if you reach then perfect, you found the right dose, you monitor, provided you're producing 1 or 2 follicles, then that's the right dose for you. So, and yes, to determine, and also if it doesn't work, then you may need to use FSH actual injection, gonal-f or menopur, instead of letrozole or Clomid, because you may not be able to reach high enough level of FSH to induce ovulation in PCOS with very high AMH. So you try 2 tablets, if it doesn't work, 3 tablets, 7.5 milligram doesn't work, then you move straight to the menopur or gonal-f or Purigon, one of those FSH drugs, to achieve ovulation induction. So, and also AMH level is used to estimate the risk of ovarian hyperstimulation syndrome in ovulation induction. Yes, in ovulation induction, also women can have a OHSS, not only in IVF. Even Clomid or letrozole can give you OHSS, although it's rare, but it can. And if this is a women who have a very high AMH levels, the ones who have who are at risk of OHSS, if they do ovulation induction. Why? Because you use a high dose like 7.5 milligrams of letrozole, then when you ovulate, you may ovulate multiple follicles. You may activate multiple follicles. This is why if you have very high AMH, you need to have a monitoring of ovulation induction, at least until you establish what is the right dose for you. Especially if you're using high dose of letrozole, 7.5 milligrams, you need to monitor to ensure you are not developing OHSS. And also if you're using FSH drugs with very high AMHs, you start with a low dose, let us say 50 units, 75 units, then you don't respond because of high AMH, you keep increasing to 100 units and 125 units, suddenly you over response. Why? Because the ceiling of AMH pushes to your follicles so much. Once your FSH goes up, external or internal FSH goes up, suddenly there's like 20, 30 follicles waiting for that level of FSH, and then all take off. And suddenly you can have ovarian hyperstimulation syndrome. So, and we use AMH for these 4 purposes.